afternoon, everyone. Thank you so much for joining another one of our live Q&A videos. We're so happy to be able to do another one of these today on a brand new topic, which we've not done a video on before. So thank you so much for everyone who's going to be watching and listening. Thank you to those people who have already submitted your questions. If you are watching the video and you do have a question that you've not already submitted, you can just put them down in the comments section below, and we'll be trying to get through as many of them as possible, and we'll do our best to answer your questions as best we can. So do let us know if you have any more that you'd like us to get through. Before we go into the video, I'd just like to say thank you so much to everyone who's been supporting the charity recently. We've got some great activity coming up in the month of September. So we've got another Q&A on the 17th, and that is going to be about quality of life research in sarcoidosis patients. That will be a really interesting video that we'll be talking about, and it would be great if you guys could join that as well. As always, if you have any questions about that one, you can go back on our previous social media posts and submit the questions under the relevant post for that one, for the Q&A on the 17th. Some of you may know already, we're doing a big Sarcoidosis UK walk on the 18th to raise funds and raise awareness of the disease. So if you haven't already, it would be great if you could sign up. We'll repost the link to sign up in the comments section of this video as well. Get your friends and family involved too. It will be a great thing that you can do as a group or with a few colleagues even. We'll be walking on the day as well, so you can keep up with that on our social media stories. So as I said, that's on the 18th of September. Then towards the end of the month, we have got World Lung Day, and we've got some great activity planned around that as well. So stay tuned, look on our social media for updates around what we'll be doing towards the end of the month. And as I said, any support that we can get throughout the month of September is fantastic and will enable us to keep doing things like this, like these Q&A videos, and spreading information to patients who really need it. Now, onto the video today. I'd like to give an introduction to our guest speaker. She is Dr. Nadia Nathan, and she is a paediatric pulmonologist based in Paris. She works with children with rare diseases, including children with interstitial lung disease, and she has experience of working with children diagnosed with sarcoidosis. Her centre is an ERN reference centre for children with rare diseases, and she's done kind of research based on lung sarcoidosis in children, so really has a great breadth of knowledge that we're going to be able to tap into today. So thank you so much for joining us, Dr. Nadia Nathan. It's great to have you.
Thank you very much for having me. Thank you for the invitation. I'm really happy to participate to this Q&A session. So I got a few questions already, but please don't hesitate to post some more if you have, and I will try to answer as much as I can to your questions.
That's fantastic. Thank you so much. As I said, we're so grateful that you're here to join us today and speak about this topic that we've not spoken about before in a video. So I think this is going to be a really great opportunity to answer some much needed questions. So without further ado, let's just kind of start off for people who don't have an awareness. I'm sure a lot of people watching won't know. How rare is sarcoidosis in children? Is it something that you see quite commonly, or is this quite a rare occurrence?
So it's a very rare disease, rarer than most of the children with interstitial lung disease. We don't have a really exact evaluation of the incidence of the prevalence of the disease, but the estimation is less than 1 per 100,000 children. This is what we found in our respiratory network. Currently, we have 55 patients with a pediatric onset sarcoidosis that are registered, but most of them are already adults now. We obviously have missed some patients with non-respiratory disease. I'm really aware of that, for example, with rheumatologic, ophthalmologic disease. And in my experience, we diagnose 1 to 3 new patients per year in France.
Okay, so yeah, as you said, that really is quite a rare occurrence. And with children, can it affect children of any age? Is it more common in a certain age group?
Yeah, it's more common in teenagers. So most of the children are aged between 11 and 12 years old. The mean age at diagnosis is around 11 years old. But however, we have 1/3 of the children that are less than 10 years old at diagnosis. And we have extreme ages. The youngest was 11 months at diagnosis. So this could happen at any age, I think.
Wow, okay, yeah, it's both ends of the spectrum then. Someone called Marco sent in a question to say that they wanted to know the risk of a child developing sarcoidosis if one or both of the parents are patients themselves.
So I will have to have some jokers in your question because some are really tricky, and this is unknown. Among the 55 patients, 4 have a family disease. One, it's the father, one the uncle, 2 are brothers, but it's a very important question. It's really hard to answer for now, and it may adult later in adulthood. So when we diagnose the children, the parents can be healthy or look healthy and may develop sarcoidosis later. Currently, we have genetic studies ongoing on this topic, and I think we will speak about that later.
Yeah, as you touched on there, it's the cause of sarcoidosis, even in adults, is also not known. So whilst genetics might play a part, it's a very difficult question to answer in terms of 100% probability or unprobability.
Exactly.
Great, yeah. So do you think, with your experience, do you notice that a lot of children with sarcoidosis might go undiagnosed, or do you think it's actually easier to pick up in children sarcoidosis compared to in adult patients?
No, it's hard to diagnose, and that's a very good question. We don't know if there are some children not undiagnosed. It's important for me to distinguish 2 kinds of situations. A patient who has symptoms and has no diagnosis, and this shouldn't happen anymore, but it has to be, the children has to be referred to reference center and expert teams to make the diagnosis. The other situation is the patient without any symptoms. And this is possible. We know in adults that it's possible, but those remain undiagnosed in children because we don't do systematic chest radiographies or systematic blood examination to search for sarcoidosis.
Yeah, and we see in adult cases a lot that some people actually don't get diagnosed for a number of years. We find that a lot of people that come to support for us say that they have been experiencing symptoms, or they have been misdiagnosed with something else for even as long as like 10, 15 years. So even in adult cases, we do see it is very difficult, and the diagnosis kind of time span can often be quite long. So that's very interesting to see that kind of resonates. It could resonate in children cases as well. A question sent in from Peter was, what do you think could be done if sarcoid was found early in young children? Is it that we could have kind of better treatment options if it's found at a younger age?
Yes, thanks, Peter, for the question. And again, it depends whether or not the child is symptomatic or not. If the child is not symptomatic, which you usually don't treat, even if there are radiological or biological findings. If symptomatic, then we start a corticosteroid treatment. And a delayed diagnosis may lead to the spread of the disease in multiple organs. And it is now well known that the number of organs that are involved at diagnosis is an important finding for the prognosis. So maybe it's linked to the length of the disease, but this is still unknown. So I'm not sure how to answer your question. Probably we have to treat as soon as the disease is a problem for the child.
Yeah, okay. And then you mentioned there kind of the symptoms and things. What are some of the warning signs that people could look out for? Would it include things such as tiredness and concentration, or are there other more physical elements that might be at play that people can look out for as early signs of sarcoidosis?
Yes, it has been reported, as in adults, that fatigue and scholar difficulties are often seen in children. It's very aspecific, it's very hard to input that to sarcoidosis, but if you know that your child has sarcoidosis, then you can be really aware of these little signs, very tiny signs, almost on fatigue and concentration, yes.
Okay, great. It's definitely, yeah, a good point there that you've made, that it could include signs like those. So good to be aware. Another question that came in from Peter was, is there anything proactive we can do to help our children who might have sarcoidosis? So this, I suppose, comes from a point of view of someone who is a parent of a child who's been diagnosed or is currently in the process of perhaps the doctors thinking that it could be sarcoidosis. How, as a parent, do you kind of proactively help them or support them in that journey?
So your group is very proactive, and this helps a lot. it helps the doctors, and because they can hear a lot of stories of sarcoidosis and increase their knowledge, but it also helps patient to patients. So your help is needed for research, of course. For example, there is a patient register on the European Research Rare Disease Network, the LUN website, and it allows patients to fill their own data. And we know that when the data are filled by the patient, they're even more precise than when it's the doctors who fill the data, and they are more they're more happy to fill the longitudinal data and to go back to the data and to fill some more day after day. This will help a lot to have a longitudinal overview of the sarcoidosis process, and this is what we miss for the moment.
Okay, yeah, that's really interesting. Thank you for answering that question. Another thing that we'd like to touch on, you kind of said that we've identified it's extremely rare for children to be diagnosed with sarcoidosis, and it's difficult to know if genetics do play a part. Are there any common factors that you, through your studies, have identified as common, be it with children's environments or background, their heritage that they grow up in? Is there any common factors amongst these sarcoid cases that we do have that might be kind of indicators of something more at play?
Yeah, thank you for asking, because we've just finished a very interesting study on mineral exposure in sarcoidosis. So this is dust exposure, and as you know, it has been suggested that this could be a trigger for adult sarcoidosis. In children, we wanted to know if it was the same or not. And interestingly, we found that the exposure scores of the patient due to their occupation was related to children's sarcoidosis as compared with controls. So it's only a preliminary report, and it's only on the French cohort, so it has only a small value, and it has to be confirmed by larger studies. But anyway, it's very interesting, as we know now that mineral dust could act as foreign body inside the organs, and together with an appropriate immune reaction, it could lead to the granuloma formation. And lung, skin, eyes, they are highly exposed to the environment. So this is a very interesting hypothesis.
Yeah, that's very interesting and very timely, as you said, that has just kind of, the work's just been completed around that. So yeah, that's a really interesting thing to point out there. So going back to kind of the treatment side of things, there must be some differences between the way that we treat sarcoidosis with adults versus in children. I know that a lot of our patients who might be watching this do get steroids as treatment. Would the same kind of treatment be given to a child, or are there other factors that you need to consider that there might be big differences between?
So we are used to treat children really aggressively, and it's not only for sarcoidosis, it's for all children with interstitial lung disease. We use also corticosteroids as in adults, but we use high-dose intravenous methylprednisolone pulses every month, and this could be for months or years. Sometimes we have to add oral corticosteroids as well, and sometimes immunosuppressive drugs, but these are rare cases. And most of the time we have a great success with corticosteroids.
Okay, thank you. That's really interesting. That kind of leads on to our next point, the question that came in from Penny. Thank you so much for submitting your question, Penny. She says, if steroids are the first line treatment, do they go on to continuous steroids after the first pulse therapy, or kind of transfer to other agents, for example, infliximab, that won't interfere with growth, etc.? So I suppose that's kind of something to consider as well. Obviously, depending on the age of the child, they might be going through puberty or through kind of very early stage growth. Is that something to consider, that if steroids are first used, are they going to be continuously used, or will there come a point where they'll have to go to another sort of treatment depending on what age growth stage they're in?
Yes, so this is our main difference with adult pulmonologists. We are working on a growing organism. So we have to deal with growth issue, and we have to be really aware of this serious side effects. Intravenous corticosteroid pulses are usually really well tolerated, and they have fewer side effects than the oral continuous or corticosteroids treatment. So For now, we have very few growth side effects using intravenous pulses, and it could last for years without any side effects. Sometimes we have problems with arterial pressure, very few problems with glucose tolerance, but really not or very few side effects on growth.
Okay, thank you for answering that question as well. That's great. And in terms of remission or kind of relapsing or, you know, experiencing symptoms again at a much later age, do they seem to be better or worse in terms of adult? Because as I've said, a lot of our patients as well kind of go into remission for long periods of time. They might not have any symptoms for, say, 10, 15 years, and then it kind of comes back. Is there any evidence to suggest that if you have sarcoidosis as a child and get appropriate treatment, that you might have a longer period in remission? Or is it likely that since you've had it since a young age, that kind of will be shortened and you could have a lot of relapses?
Yes, so thank you, Penny, again for this question. You know already that pediatric sarcoidosis is a multi-organic disorder, and when we diagnose children, they already have 3 to 4 organs that are involved. And often they have general symptoms, fatigue, fever, weight loss, as we have already discussed, and they are often at the forefront of the presentation. When we are looking to the evolution, and we did a study on that has been published recently, we found that around 50% of the patient will still have a disease at adult age, either a continuous disease or either a relapse at adult age. But we have also 50% of the patient who will recover before adulthood and will not present any relapse. So it's hard to know which of the patients, which of the children will go to one or the other way. And we don't have any evidence for now to say if the children will completely recover or not.
Okay, yeah, that's kind of the case a lot in adult sarcoidosis as well, with a lot of questions. There is just not enough evidence at this stage, perhaps something that might change in the future. But yeah, that will be interesting to see. And that obviously sparks the need for more research and kind of, you know, studies that can be done, both funded by charities such as Sarcoidosis UK and others that are working to find the answers that are so needed for many people. Peter also asked, he said, speaking as an adult, is there any way to know retrospectively that we had sarcoid as a child? So this is someone who's got a diagnosis in adult life. Is there any way to know if you had it as a child? And he just put a bit of a backstory there that he spoke with Professor Wells for a very long time looking at past history, and together they thought that his sarcoid might have started at around age 11, but it didn't come into play really until 26 that it was finally diagnosed. So do you think there is any way to tell that if an adult has sarcoid in their later life, if they had it as a child, or is there just not enough indicators for that?
Yes, thanks, Peter. It's a very tricky question to answer. As we said, the symptoms may be light, may be aspecific, and the retrospective history is always difficult to collect. However, in our experience, when talking with the families, they always suspect that the sarcoidosis began months to years before the diagnosis. So it could be taken as good news, but it's, however, the case for a lot of other rare diseases. We could suspect that if it's not diagnosed, it was because it was very light and maybe very well tolerated by the child, and it wouldn't have been treated anyway.
Okay, yeah, thank you for that one. June has also sent in a question about her granddaughter. So she said, my granddaughter has issues with low heart rate and low blood pressure. She also has issues with her thyroid, and she suggested to her granddaughter that she should get herself checked out. Do you think that that could be an indicator of sarcoid? So it was low heart rate, low blood pressure and thyroid issues.
So I thought about take your question as a joker and not answering to that one, but I will try anyway. You know that sarcoidosis may affect all organs and in a highly various ways. Heart and thyroid is obviously not the most usual affected organ in children, but with only the few info that you gave me, I'm sorry that I can't eliminate 100% sarcoidosis. Let's say that it's a very, very low probability that it could be sarcoidosis.
Yeah, okay. It is very important in situations like those, if you kind of have suspicions yourself or think that your granddaughter or anyone that you know might have sarcoidosis, that it could also be a range of other things, and it's important to speak to a medical professional, get appointments with doctors and relevant tests that are needed. As we've mentioned previously in the video, there is quite a long path to diagnosis, and it very well might be that it's something else. So completely understand why that one is a bit too difficult to answer at this stage. A question that came in from Jackie. She said, do you think the following undiagnosed episode as a 2-year-old could have been sarcoidosis? So this is another one where we probably won't get a definite answer, but it's interesting to see what the probability might be. So she said, I was diagnosed at 18, but at 2 years old, a sudden undiagnosed illness caused me to have respiratory problems, loss of speech, and personally, I couldn't walk and lost control of my right eye. I recovered but had eye inflammation through childhood and was only diagnosed with sarcoidosis when my eyes, skin, and lungs fled at 18. I've had neuro symptoms since then and have spinal cord sarcoid. I've never been able to find references to neurosarcoidosis in childhood until I read your paper on pediatric sarcoidosis. Could this have been neurosarcoidosis at such a young age?
Yeah, so thanks a lot for sharing this story, Jackie. Retrospectively, I would bet that yes, it was the onset of the disease. I would say that, even if I have no proof. Neurosarcoidosis is really rare, and it exists, and it has to be treated very aggressively. If not, it can last or have sequelae, as you report for yourself. Again, it's really easier to speculate now on the initial diagnosis years after the story, but I think it's important to think about sarcoidosis when facing such really unusual symptoms. Talking now almost daily with the adult pulmonologist in care of sarcoidosis patients that are adults, I'm pretty sure that a high rate of them had sarcoidosis in childhood that was undiagnosed.
Okay, that's really interesting. Thank you. So yeah, it seems with that one, since the pointers and indicators were so kind of unique and similar to that of neurosarcoid, that it could well have been at that age. Another question that came in is about a database. So Peter wants to know if there is a database that can track outcomes for children with sarcoid. For too long, there seems to be a messy situation that outcomes are declared as acute or chronic, when recurrent sarcoid also seems very prevalent too. So is there anything like that that exists at the moment, or is that something that needs looking into?
It exists, but it's not perfect. We have a French database for rare lung disease that is called Respirar. We also have a European database for children interstitial lung disease, but it's a one-point database, so it's not a longitudinal collect of the data. We also have the patient ERN lung database that the patient are free to fill. So these databases are not talking to each other. So we have a few info in all the database, and I think that our aim is now to have an international complete database, but this is maybe a dream, I don't know. I'm really confident in the fact that this database will anyway provide insightful information for sarcoidosis in adults and in children. We have still to work on it.
Well, that's fantastic that something like that does exist already. Although, as you said, it's not perfect. It's at least a step in the right direction, and it's great that something like that does exist. So just going on to another question that Penny sent in. She said, are they doing genome analysis in children to identify any genetic markers? And if so, with what results? And are the genetic markers for early onset sarcoidosis likely to be the same as for late onset? And will we be able to use them for screening children?
Yes, thank you, Penny. You are absolutely correct. We are studying by many ways. We are studying trios. This is one sick children with his two healthy parents, but also families to compare the individual who has sarcoidosis and those who don't. And this study are still ongoing. but they already provide very interesting results that targeted some genes involved in immunity and autophagy. Autophagy is the ability of the cells to digest foreign bodies, and that could be mineral dust, for example, and also targeting cell cycle. So this is the ability of the cell to renew or not to renew. We are really far from ready to propose a screening to the children and also to the adults. It's only a combination of gene variants at the time. But as you know, genome studies are quickly progressing, and it will be the next century's medical highlight, I think. And I trust so it will provide some more precise data soon.
Okay, that's great. Yeah, it's very interesting that that could kind of be the future in the next, 10, 15, 20 years. Kind of leading on from that then, in terms of next steps, you've mentioned a couple of things there, like improvement of the database, genome analysis, etc. Is there anything else that's currently lacking, do you think, in kind of both the diagnosis of sarcoidosis in children and the treatment, that are kind of some shorter term things that we could be improving the scope right now, or is all the improvements that are needed, are they more medium to long term?
We are probably lacking some quality of life information, and I heard that you were talking about a talk on this topic next week or in a couple of weeks. So this has been done for children interstitial lung disease, but not for the specific group of children sarcoidosis, and this could be really interesting because it helps improving our treatment that could target what is involved in a lower quality of life. This is important for us, and what is really important is the long-term follow-up of the patients. Just to be able to answer most of your questions today, and what I wasn't able to do for a lot of your questions. And this is lacking for now, being able to follow the patient, even if they seem completely healed until adulthood.
Yeah, that's something that would definitely be very interesting, because as we've discussed quite a few of the questions, there's just not enough evidence or data at the moment to support it. But with something like that, following the patient for life, then we might have a lot better answers, say in 30 years' time, as to the role that genetics could play, or the role that the different symptoms versus in a child versus adult plays. That's a really interesting point there. Kind of just to summarize then, what are the kind of key takeaways then for the topic as a whole, children in sarcoidosis? What are the key things that we need to be focusing on? Is it kind of, as you mentioned there, we need more emphasis on research and quality of life, and ensuring that children are diagnosed when they should be and treated well? Are there any other key takeaways that parents who might have a child diagnosed with sarcoid, or someone might know of someone, that we need to be thinking about and kind of propelling that forward, and also work that we could maybe do as a charity to help around this topic?
Takeaway message will be, first tip is to think about it when you suspect unusual symptoms. It's really rare, but as you know, it exists. And the main difficulty is to point out this diagnosis and not to let the children go from one doctor to the other with no diagnosis. So this is the most important thing for us, to collect and to gather the children in expert centers, to learn from them and to be able to treat them better. The second thing is to have what we are doing now, is the collaboration with the patient groups, and have their feedback on what we are doing and on what they are expecting us to do. And I encourage all the patients to join the groups. Most of them don't join the group because maybe they don't think it could be useful, but knowing you a little bit more now, I know how important it is. So thank you very much for doing what you're doing. And the other key message is not to think that it's exactly the same that adult sarcoidosis. Pediatric sarcoidosis seems a little bit more severe, a little bit more multi-organic disease, and we are really concerned about scholarship. So we want them to be healthy and to be able to go to school, not to be tired, not to have fever, not to be concentrate on their disease. The important thing for us is them to have a normal children's life.
Yeah, that's great. Thank you so much. I think you summed everything up perfectly there that we've spoken about in the video. And just to highlight, you kind of mentioned the groups and how important that is for anyone who is watching and is not part of our group. We have a very active Facebook group and there are nearly 6,000 members. And even if you are someone with a child with sarcoidosis, you know, as we've mentioned, that is incredibly rare, but even talking to an adult patient of sarcoidosis could just, you know, still provide that bit of support system, even though you're not going through the exact same thing. The sarcoidosis as a whole disease is very rare as well. So, you know, you might find things in common. So if you would like to join that group, then we'll also post the link in the video comments. So please do check that out. And I just want to say thank you so much, Nadia, for giving up your time for us. As I said at the start of this video, we've not done a video talking about sarcoidosis in children, and you uncovered some really interesting things there. I think it's great as well that we've got an idea of where we need to be headed in the future, and kind of know as a charity what we can be doing to support parents that are going through their child being diagnosed, and what we can do to advocate as well for change, both in the UK and further afield, to really improve this area. So I think it's great that we've been able to have this discussion today, and we thank you so much.
Thank you so much. Thank you for having me today, and thank you for what you're doing today.
No, you're more than welcome. Thank you. So for everyone that's been watching, thank you so much. Again, we really appreciate all your comments that have been submitted, and it's great that we're able to do these videos and get people like Nadia in to speak to us. But the only way we are able to do so is through your generous donations and support. We don't receive any government funding, so we are reliant on your support. And if you would like to make a donation following this video, you can do so over on our website, and the link will also be posted in the comments section. And alternatively, if you'd like to get more involved with some of our fundraising activities, as I said at the beginning of the video, we have got a walk coming up at the end of the month. If you'd like to sign up, then that would be absolutely fantastic. And the more support we can gather around sarcoidosis and connecting everyone together, the better. So it really does mean the world if you're able to show your support in this way. If not, simply raising awareness of the disease is also another fantastic way that you can help out, just by spreading information around to your friends, family, work colleagues. It's little things like that can really make the difference in the long run. So thank you so much. Thank you once again to Nadia, and we look forward to having some more Q&As and videos coming up later on in the month. So as I said, keep an eye on our social media pages, guys, and thank you so much again for joining today. Until next time, bye-bye.
Bye-bye.